Well, I had the back molars were covered with gums, so they weren't growing in. My orthodontist recommended me to go to my oral surgeon.
So usually the orthodontist is where most of the patients kind of start out, just kind of traditional braces and, okay, we're going to straighten your teeth out. And then they've usually, by the time they come to see the surgeons, they've tried for 6 months, 8 months, sometimes a year or longer to make space for that tooth, that impacted tooth, whether it's a canine or a second molar. And then they finally get to the point where they say, you know what, this tooth is not going to make its way into the mouth without some assistance. So that's when then the orthodontist will send the patient over to us.
He showed me the x-ray of my teeth and pointed out what tooth it was, and it was pretty far back where he had to pull up exactly what he was going to do on the day of the procedure. And then when I got there, he explained everything that was going to happen. So how long it was going to take, what the recovery was, and what they were actually doing.
We're going to go in and remove whatever tissue we need out of the way and glue a bracket to the tooth. And then there's going to be a little chain that comes out, and we're going to tie it to your orthodontic wire. You're not going to even know what's there. You don't have to do anything different. You're still going to brush, floss, do everything that you should be doing. And then shortly after, we're going to get you to your orthodontist, and he's going to put special brackets or springs or whatever it may be, chains on there to help move those teeth down, so that eventually you're going to be able to use them and chew with them. If you leave a tooth impacted, just because it's buried underneath the gum tissue underneath bone doesn't mean that it can't develop some disease process. They can cause damage to the adjacent teeth, the adjacent structures. So just like impacted wisdom teeth, the same reasons that we would take those teeth out.
And I was nervous, but it went fast. I was under anesthesia. I was back in the recovery room. I was joking with my family and stuff right after, so I was in good spirits. It took I'd say like a couple months for the molars to grow in. Some of the chains didn't feel too great, but it made it go faster. I'd say it's well worth it to do it. Yeah, it's gonna hurt. Yeah, you're gonna be out for a little bit, but if it's something that's gonna affect you in the future negatively and you can fix it now, why not fix it? So I'd say 100% do it.
In terms of the specialties in dentistry, oral and maxillofacial surgeons are the best suited to do complex, not only any type of maxillofacial surgery, but in particular intraoral surgical procedures. There's a lot of delicate structures that we're dealing with, and an oral maxillofacial surgeon is well suited to handle all those particular issues when things go well and when things don't go well, and have a good outcome for our patients.
I'm a lot happier with it now. I didn't smile with my teeth before then, now I do. I'm a lot happier that I had braces and all the surgery done.